Onvansertib basically is a polo-like kinase inhibitor. So polo-like kinase inhibitors are basically important in cancer cell survival and progression in acute myeloid leukemia and other cancers actually. They are master regulators of the cell cycle. So there are a number of the polo-like kinase inhibitors that have been studied in the past. One of them is volasertib. However, this was a non-specific inhibitor, and it had a much longer half-life than onvansertib. This resulted in a positive phase 2 trial, but the phase 3 was negative. So onvansertib takes a step, I think, that is important in terms of improvement upon volasertib with an agent that is an oral agent. So this is an oral agent. The half-life is 24 hours, so it's shorter. And I think that translates into less toxicity and less cytopenias, as well as basically being specific compared to the pan-polo-like kinase inhibitor, volasertib. So based on all of this preclinical data that were very encouraging in preclinical studies, this was taken into a phase 2 trial that has been ongoing, which I presented the results in the American Society of Hematology meeting previously, and now we are providing an update in the European Hematology Association meeting. And I think what we are showing here basically is that the combination in a patient population with relapsed refractory AML, which is a very difficult patient population to treat, as many of your audience know, we see good responses, and some of those patients have durable responses, which I think is quite encouraging. And we are starting to look also at predictors in this patient population, looking at circulating tumor or cell-free tumor DNA as a biomarker for response. And I think this agent seems to have interesting activity. And I think the question right now is how to better select patients for this type of treatment. Of course, this trial is still ongoing. We need more patients and longer follow-up, but I'm encouraged by the early results with this combination.